Hi there, I get a lot of inquiries about lips, and this is information that I cover in a lot more detail in the consultation, but I thought it might be helpful to give you a heads up on why and how I practice in the way that I do. So if you don't already know me, you know my name's Nofie, I'm a registered nurse. I've been working in aesthetic medicine for about 5 years now, and I've now left the NHS in order to focus on my private work, so I am working full time. Lips have been consistently one of my most popular treatments. This is because no matter what your age, if you're younger, enhancing your lips can really dramatically change your look. If you're older, just even the smallest amount of lip volume really softens the face. So where the lip goes a little bit flat, where you lose some of the shape, having a very small amount of lip volume can literally take years off a person's face. Really kind of softens it, makes it more feminine, more attractive. Product-wise, I talk to you in depth about the products that I use in clinic. I'm most comfortable with using some of the very well-known brands. There are now 150 different brands on the market. When I see people selling lip treatments for what I class as bargain basement prices, I can't even buy my products at these prices. So what does that tell you really as regards the level of quality, the level of assuredness, access to medical faculty if you need it? For me, it's a no-brainer. I like to sleep well at night, which is why, to the best of my ability, I'll always try and select the most appropriate treatment for the area that I'm treating, and also for that product to come from one of the heritage brands, unless of course you feel differently. But yeah, in my experience, I'll try and persuade you otherwise, and it's rare that I've come across somebody who doesn't see it in the way that I do. So lips wise, we're looking at a fairly short procedure in itself. It doesn't need to be too long. So please don't be concerned that you're going to be in too much pain or discomfort for a long time. I find most people tolerate the procedure very well. Certainly we're very used to discomfort. You know, if you're female, you're used to period pains. You're also used to areas of your body perhaps being waxed or plucked. Many people also have tattoos, so they tolerate the treatment incredibly well. I would say that in my experience, lips and nose tend to be the most painful procedures, which is why if you can tolerate lips, I know that you're going to be fine with any other procedures that you might be interested in the future. There are certain risks associated with dermal filler procedures, particularly ones that happen here in the mid-face, so that's between the eyebrows, the nose, the lips and the chin, and that's something that I talk to you about in detail in clinic. There is some aftercare that I need you to be aware of. What I'm finding in my practice at the moment that I think may be of interest is for people who have had dermal filler in their bodies for extended periods of time. So for some people, they do not break down the hyaluronic acid, which is the dermal filler, very quickly. That can sometimes cause a little bit of a problem, maybe 2 years, 3 years later if I get to see a person at a later date. This is because the body isn't breaking it down evenly. Maybe small amounts of it can just kind of pad out a little bit. So for the lips, you may get a little bit of product here on the perioral area. On the nose, you can notice that the bridge widens a little bit. These things are very easily solved. If you are my patient, if I've performed that dermal filler procedure on you, I'm more than happy to use a small amount of an enzyme to dissolve any of that old product that could be problematic, and we start from scratch. That's easy peasy. If you're not my patient, then there will be a charge associated with that. That's why I would encourage you to please go back to your original injector for them to resolve that for you. That's something, of course, I would want my patients to do, for instance. So I afford other injectors that courtesy. Hope that helps. Any questions, let me know. Lots of people know about the lip procedure now, so you're welcome to ask me any of the introductory questions, any of the advanced questions. That is no problem. Hope to speak to you soon. Bye.